Human anatomy and medical terminology. Working in medical coding involves becoming fluent in medical terminology. Learn some of the most common anatomical and surgical terms by looking at suffixes, prefixes, and roots.
In our previous courses, you may have noticed a number of complex anatomy and physiology terms getting tossed around. It's easy to get confused by medical terminology. Thankfully, medical vocab is more bark than bite. If you can familiarize yourself with some prefixes, suffixes, and roots, you'll be well on your way to mastering the official medical language of the body. Let's start off with the basics. Numbers. Many times you'll encounter a medical term that contains a prefix that describes a number. Here are a few of the most common. The prefixes mono or uni means one, for example, unilateral. The prefix bi means two, used in bilateral. Similarly, the prefix tri means three, used in triplicate. Directions and positions. In medicine, you'll often encounter terms that describe where a procedure or condition takes place on the body. For example, the prefix ab means away from, used in abduction. Ad means toward, used in adduction. Prefixes ecto or exo means outside, like in the word ectoparasite. Endo means inside, used in endoderm. And the prefix epi means upon, used in epinephrine. There are also a number of positional and directional medical terms that are not suffixes or prefixes, but are instead standalone words. Here's a short list of some of the most valuable. Anterior or ventral means at or near the front surface of the body. For example, anterior nerves. Posterior or dorsal means at or near the rear surface of the body, used in dorsal surface of the hand. Superior means above. For example, superior cranial aspect. Similarly, inferior means below, used in inferior aspect. Lateral means side, used in lateral aspect. Distal means farthest from center, used in axons distal to the injury. Proximal, think proximity, means nearest to the center, used in proximal end of the forearm. Basic anatomy terms. These terms will help you navigate the CPT and ICD manuals, decipher doctors' reports, and give you a more thorough understanding of the medical practice in general. Let's look now at a few basic terms for the regions of the body. You might recognize some of them. Abdominal refers to abdomen. Buccal is cheek. Cranial is skull. Digital refers to fingers and toes. Femoral is thigh. Gluteal is buttock. Hallux is great toe. Inguinal is groin. Lumbar is the loin in the lowest part of the spine, below the false ribs and between the hips. Mammary is breast. Nasal is nose. Occipital is back of head. Pectoral means chest. Sternal refers to breastbone. Thoracic is chest. Umbilical is navel, and ventral is the belly. Conditions. Now that we've taken a look at the terms that describe the major regions of the body, let's turn to some conditions that may affect those body parts. The prefix ambi means both, used in ambidextrous. Dys means bad, painful, difficult, used in dyslexia. Eu means good, normal, used in eukaryote. Homo means same, used in homogeneous. Iso means equal or same, used in isotope. And the prefix mal means bad or poor, used in malnutrition. Some common suffixes include algia, which means pain, like in the word myalgia. The suffix emia refers to blood, like the word hypoglycemia. Itis means inflammation, used in bronchitis. Lysis means destruction or breakdown, used in dialysis. Oid means like, for example in the word haploid. Apathy refers to disease of, used in neuropathy. And the suffix pnea refers to breathing, used in sleep apnea. Surgical procedures. Let's wrap up this vocabulary review with a look at some of the most common surgical procedures. Since it's always imperative to list where on the body a surgical procedure was performed, these vocabulary terms are a small but useful addition to this section. Memorize the meanings of these suffixes and you'll know instantly what kind of procedure was performed, even if you don't know exactly what the procedure did. The suffix centesis means puncture a cavity to remove fluid, used in amniocentesis. Ectomy means surgical removal or excision, used in hysterectomy. Ostomy means a new permanent opening, used in tracheostomy. Otomy means cutting into or incision, used in gastrotomy. Oriphy tells us the procedure was a surgical repair or suture, used in the word gastrorrhaphy. Apexy means surgical fixation like in nephropexy. Oplasty also refers to a surgical repair, like in the word rhinoplasty. And finally, the suffix autopsy means crushing or destroying, used in lithotripsy. Note that you can also use your CPT manual to study human anatomy vocabulary. Current CPT manuals come with instructive illustrations, diagrams, and charts all throughout the book. In the front of the CPT manual, you should be able to find a list of anatomical illustrations. Bookmark this page and refer to it in case you're looking for an illustration of the eye or inner ear, or need to remember which artery goes where. Also, be sure to download our ebook for more detailed tables on medical terminology.